When it comes to healthcare in the United States, it's no surprise that most people despise it. I mean, broadly speaking, American healthcare sucks.
The shady part of insurance is this. If you argue enough, you can get everything you deserve.
While you die waiting.
Yes.
Yeah.
The explanation for this is quite simple: profit.
And this is what happens when you allow Wall Street to run your system of health insurance.
But the problem isn't just why this is happening, as for most of us, it's all we've ever known. What I want to understand is why it hasn't been fixed yet, and better yet, why it probably won't be fixed anytime in the near future.
In the United States of America, no one should go broke because they get sick.
Everybody's got to be covered. This is an un-Republican thing for me to say, but
universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not.
Who pays for it?
The government's going to pay for it, but we're going to save so much money on the other side.
As a physician, I denied a man a necessary operation that would have saved his life and thus cost his death. Because in fact, what I did was I saved a company $500,000.
We're talking about some 68,000 Americans who die every single year because they are uninsured or underinsured and don't get the medical care that they need. This is the United States, the wealthiest country in the history of the world.
The American healthcare system didn't initially emerge as an expensive and complex maze overnight. It's the product of a series of deliberate decisions influenced by politics, profit, and ideology. But in order to understand how the US got here, we do need to look back at a few key milestones that stamped themselves into what Americans know today as the healthcare system. While this is by no means a comprehensive summary, it should establish some critical context and help us understand why a brighter future for healthcare seems elusive today. In the 1940s, during World War II, the US government imposed wage controls to curb inflation and allocate resources effectively to try to fund the war machine. These controls limited how much employers could pay workers. And so in order to attract and retain employees without violating the wage cap, employers began offering benefits such as health insurance as part of these compensation packages. The government further encouraged this practice by making employer-sponsored health insurance premiums tax deductible for employers, and they made it tax-free for employees under an IRS ruling. Now, this tax incentive reduced the costs of providing such benefits, making health insurance an appealing, cost-efficient option for employers to compete for workers. But by the 1950s, after a decade of growth in the industry, the IRS was like, wait a minute, we made this thing tax-free? What were we thinking? And so the IRS tried to reverse course so that they could start collecting tax dollars on this revenue. The Eisenhower administration says no and ultimately locks in the employer-based system. This policy laid the foundation for the employer-based healthcare system that we see largely today, even though it was initially a workaround for wartime economic restrictions. It was not explicitly designed to create a healthcare system, but became one as it gained popularity and momentum post-war. But this created another problem, because it left people who weren't employed to fend for themselves. However, before Eisenhower came into office, President Truman tried to solve this problem with Medicare. This was a government-sponsored health insurance plan mostly for people 65 and older, but also included younger people with certain disabilities or fatal illnesses. But this didn't pass, at least not for another several years. So when John F. Kennedy became president in the early 60s, he really tried to push for Medicare, but he would never get a chance to see it through because, as we know today, JFK was assassinated in 1963. But his vice president, Lyndon Johnson, was tasked with passing JFK's agenda, which included Medicare. And he eventually did succeed in doing this in 1965. But by the 1970s, rising healthcare costs prompted policymakers to seek strategies that would lower expenses, or at least try to. President Richard Nixon's administration promoted health maintenance organizations, or otherwise known as HMOs for short, as a solution. These HMOs can essentially be seen as what we know today as medical insurers. The Health Maintenance Organization Act of 1973 provided federal endorsements and funding for HMOs, aiming to increase efficiency and reduce expenses by emphasizing preventative care and cost control. This moment right here can really be seen as a pivotal point in American history.
One issue, and that is whether we should include these health maintenance organizations like Edgar Kaiser's Permanente thing. Now let me ask you, you give me your turn. You know I'm not too keen on any stand medical orders. This is a private enterprise one. Well, that's beautiful. Edgar Kaiser is running Permanente deal for profit. the reason he could do it, I had Edgar Kaiser come in and talk to me about this, and I went into it in some depth. All of the incentives are toward less medical care, because the less care they give them, the more money they make. The incentives are on the right way.
This was really just the beginning, though, because if we fast forward to the 1980s, where Ronald Reagan is president and deregulation and market-driven healthcare solutions are his focus, things really start to take form into what we see today. Because prior to the early 80s, payments by Medicare and other insurers were tied to costs. So if it cost a hospital $3,000 for a patient's surgery, that's what the hospital was paid, plus a little bit more for profit. But then payers, aka private insurers and government healthcare programs like Medicare, started to shift the financial risk to providers, like the hospitals and the doctors. So now that same surgery costs whatever the insurance company decides, which often is disconnected from the actual costs that the hospital incurs, including the amount of time a doctor or nurse spends on the procedure or task. And the catalyst for this major turning point was the Social Security Amendments of 1983 law, which changed how Medicare paid hospitals to a fixed price per visit, regardless of the actual costs incurred. If providers could get costs down, they made money, and if they couldn't, they lost money. As a result, this was when hospitals and insurers started to behave much more like businesses seeking revenue at every turn. The fundamental shifts that occurred further pushed healthcare spending even higher. But even with all of this happening, American life expectancy was failing to keep up with peer countries despite the American population paying ever-growing healthcare bills. Towards the end of the decade in 1987, 31 million, or around 13% of the population, was uninsured. Now keep this stat in mind for later. The 1990s attempted to bring a decade of change for healthcare, but it inevitably ended up falling short. In 1996, the Health Insurance Portability and Accountability Act, aka HIPAA, was passed, which achieved some progress with healthcare for consumers, such as aiming to protect healthcare data, and it provided some limits to exclusions for pre-existing conditions. However, despite some of these improvements, uninsured individuals ballooned to approximately 42.5 million, or 15.7% of the American population by 1997. That's almost 1 in 6 Americans that were not insured. And since the 1990s, the United States has really only experienced one major reform to healthcare through the Patient Protection and Affordable Care Act, signed into law by President Barack Obama in 2010. This is otherwise known as Obamacare. This required that all citizens have health insurance and that the poorest people in the US were to be covered under a Medicaid expansion. People with incomes in the low to mid-range who did not have access to health insurance through their jobs were now able to purchase with the help of federal subsidies through insurance exchanges. Large businesses who didn't provide health insurance or subsidies through their jobs faced penalties and were not allowed to deny insurance for any reason. Although several different loopholes have been exploited by large companies to avoid these penalties, such as classifying workers as independent contractors, hiring temporary workers, keeping employee hours below the full-time threshold, and more. So here we are today. Approximately 8% of Americans are still uninsured, and that's over 27 million people, despite some coverage changes being made in the aftermath of the COVID-19 pandemic. The White House just reported that 45 million people have insurance through the Affordable Care Act, and that more people have health insurance today than ever in our nation's history. But without these government programs, a substantial portion of the population would likely be uninsured. While exact figures are challenging to determine without comprehensive data, it's reasonable to infer that the uninsured rate could rise significantly, potentially exceeding 25% of the US population. But today, the American healthcare system has seemingly reached a tipping point. Every day, stories emerge of families being crushed by medical debt, patients dying from treatable conditions due to lack of insurance, and lives being derailed by the sheer costs of staying alive. Even those with health insurance face high premiums, unaffordable deductibles, themselves and denied claims. The system, stated by some as the best in the world, consistently ranks near the bottom in health outcomes among developed nations. Things have to change, and some people have taken some polarizing steps to send a message.
Hundreds of tips are pouring in, and thousands of police officers are cycling through a manhunt that is now nationwide. This morning, the NYPD is hoping someone recognizes these latest images of the suspected shooter of United Healthcare Chief Brian Thompson. Back at the murder scene, police say they found the words deny, defend, depose written in Sharpie on shell casings. The suspect's backpack. It contained a Tommy Hilfiger jacket and Monopoly money. Detectives are working to determine whether the play money was meant as some sort of statement.
A person has been taken into custody in Altoona, Pennsylvania.
26-year-old Luigi Mangione remains in custody in Pennsylvania as he awaits extradition back to New York to face a second-degree murder charge.
Mangione's case is not a surprise to many Americans. It's a symptom of a broader class war embedded in American economics and further amplified in healthcare. As everyday expenses rise and Americans keep getting taken advantage of, it's no surprise that a case like Mangione's is so severely amplified on social media. People are sick of the growing wealth inequality in this country, and while some might not know what is causing all of the issues, they definitely understand the current system isn't working for them. In the United States, access to quality care often depends on socioeconomic status. The wealthiest Americans can afford concierge doctors and cutting-edge treatments. Their insurance premiums and cost of care don't bankrupt them, but working-class families often struggle to afford basic care. The difference in job classes is highly correlated to level of care that one receives. This disparity is no accident, though. The healthcare industry is designed to generate profit, not ensure health. Insurance companies, pharmaceutical giants, and for-profit hospital systems rake in billions annually while denying coverage and setting arbitrary prices for treatments and care. The result? A system where the wealthy thrive and everyone else suffers. But honestly, it's more than just suffering. These companies directly impact the well-being of others by simply making a decision around covering someone's healthcare or not. And this winds up killing people, which I believe is why so many people have come out in support of Mangione. And I think Oscar-winning director Michael Moore put it best. Quote, "You can't be the CEO of a company where you knowingly deny care to people, often leading to their deaths, and not have people mad at you. People hate you. People who have no pity for you because you have no pity for them." I think this sentiment explains so much of the support that we've seen for Mangione over the last month. But now let's look at some of the staggering statistics around healthcare costs in the United States. In 2023, the US spent $4.9 trillion on healthcare. That breaks down roughly to $14,750 per person. And we should expect these figures to rise when the stats for 2024 come out. The US has the lowest life expectancy among large wealthy countries while it far outspends its peers on healthcare. New Gallup polling data shows Americans' view of healthcare quality has declined to a 24-year low, and that same data showed that 62% of Americans believe it's the responsibility of the federal government to make sure all Americans have healthcare coverage. This is at a decade high. I want you to also understand how much United Health Group, the largest private insurer in the US, made in net income over the last couple years. In 2023, they made over $22 billion. This was up over 11% from 2022 when they made over $20 billion. And this was up over 16% from 2021. This is their income, not their revenue. So when I say profit is the simple explanation for this failing system, I hope you are beginning to see the picture. But honestly, it doesn't have to be like this. Other countries like Canada and the United Kingdom both demonstrate the benefits of a single-payer system. They essentially boil down to the government funding the system through tax money, ensuring that every citizen has access to different medical services without any direct costs tied. Both of these systems achieve lower per capita healthcare costs and better health outcomes, such as lower infant mortality rates and higher life expectancies when compared to the US. While some will certainly argue that a universal healthcare system might increase wait times or destroy access to quality care, the data shows that this is simply false. A report comparing 10 European countries showed that patients reported that they saw a doctor or nurse on the same or next day from the time they sought medical care. Universal healthcare could also yield transformative benefits for individuals and the economy, eliminating premiums, deductibles, and copays, which would free up disposable income for millions of families. Easier access to preventative care would reduce chronic illness and improve productivity, which in turn could increase GDP. Centralized bargaining for drugs and services, as seen in other nations, could slash overall healthcare spending. And you want to know the best part? Americans would be paying less overall in this system than what we do now. While taxes would go up, there would be no more insurance payments, deductible payments, and out-of-pocket costs, and so on. So what really stands in the way? Why are we still dealing with these issues in 2025? Well, it's the healthcare industry who lines the pockets of our politicians and greedy individuals who don't want anything to change. They have an immense amount of financial power. And in 2023 alone, the health industry lobby spent well over $750 million on our politicians in the US. This money buys influence to make sure that proposals like Medicare for All or other universal healthcare ideas never make it past any committee who sees it. Presidents, senators, and representatives who receive campaign donations from healthcare lobbyists are incentivized to protect the status quo, prioritizing corporate profits over public health, creating a never-ending loop of stagnation for our healthcare system. A small but powerful elite stands to lose significant amounts of wealth if things change in a positive direction for the average American. Transitioning to a better system would require monumental change at the base level of our government and democratic systems. Public companies would face significant losses in revenue and potentially would have their entire business model upended. This would create volatility in the stock market around the healthcare industry and could ultimately result in significant job losses in the field. But before you go feeling too sorry for those companies, it's safe to assume a chunk of them would find other ways to monetize this new system. Ultimately, how this would play out would be completely contingent on how exactly a universal healthcare system was implemented in our country. Now, some people have tried for a better system. Look at Bernie Sanders. One of his largest campaign messages in 2016 was to the healthcare industry that things needed to change. But there are reasons as to why he was not picked to be the frontrunner of the Democratic ticket multiple times. The people at the top want to keep the status quo. And it's not just Bernie Sanders. Many politicians on both sides of the aisle will make claims during campaigns that speak to the pain points from healthcare that many Americans face. But even if they are elected, seemingly nothing changes. Now, businessman Mark Cuban is taking a different approach, trying to undercut major companies and their pharmacy benefit managers who manage prescription drug prices and try to monopolize the drug market. Cuban has launched Cost Plus Drugs, a website that offers many different medicines at prices that are often far cheaper than what you can get from your pharmacy. And while he's been clear to state this is a business venture and not something truly altruistic, he has made a point to keep a fixed profit margin across all items at 15%. This business also offers much more transparent pricing so customers can see the breakdown across the products that they may need. And while this is by no means a comprehensive fix for the health insurance issues I've listed, in my opinion, it does somewhat move us in a better direction around some prescription drugs. Now, as depressing as this whole topic is, and this piece is just merely scratching the surface, here's the somewhat silver lining. Many people do believe in the idea of healthcare reform. While the path to universal healthcare in America is steep, it's not impossible. Though the system is stacked against reform, history proves that continuous public pressure can shift political will, as we've seen by events in the news and reaction in the media lately. This is a hot topic.
Free Luigi!
But it must not be forgotten about. This conversation needs to stay alive because it will result in people demanding a better system, one which includes transparency, affordability, and ultimately focuses on the well-being of Americans, not the profits of the corporations who supply our health insurance. I want to end with another quote from Michael Moore because I think he put it best. I'll link his blog post in the description. No one needs to die. In fact, that's my point. No one needs to die. No one should die because they don't have health insurance. Not one single person should die because their health insurance denies their health care in order to make a buck, or 32 billion bucks. The solution is simple. Throw this entire system in the trash, dismantle this immoral business that profits off the lives of human beings and monetizes our deaths, that murders us or leaves us to die, destroy it all, and instead, in its place, give us all the same healthcare that every other civilized country on Earth has. Universal, free, compassionate, and full of life. Give us Scotland, give us Uruguay, give us Taiwan, give us Canada, or just give us death. Just go ahead and deny us all now the care that we will someday need. Or give us Canada, and let us get busy curling. Thank you so much for watching. If you want to learn about how subscriptions are costing you far more than you think, please be sure to check it out in this video here.